Mix a little salt and olive oil and say goodbye to pain for years. Many people report long-lasting relief after trying a simple blend from the kitchen, but results vary and this is not a guaranteed cure. If you have severe or worsening pain, an infection, or a chronic condition, check with your healthcare provider before trying home remedies. With that in mind, let's look at why this pairing, olive oil and natural salt, has been used for generations and how to do it safely. First, olive oil. Extra virgin olive oil is more than a cooking fat. It's rich in polyphenols and monounsaturated fatty acids, and it carries antioxidants that help calm low-level inflammation. Applied to the skin, olive oil creates a soothing barrier, helps the tissue glide during massage, and may allow anti-inflammatory molecules to reach surface tissues more effectively. Taken in small amounts over time, some people find it supports digestion and a balanced inflammatory response, though that effect is gradual and personal. Second, natural salt. Fine sea salt or Himalayan salt isn't just sodium chloride. It contains trace minerals like magnesium, calcium, and potassium. Topically, a fine salt can perform gentle exfoliation, draw excess fluid from swollen tissue, and stimulate microcirculation to the area you treat. That mild scrub action loosens tight surface tissue and helps massage reach deeper layers. The minerals can also support local cell function when used externally, contributing to a feeling of reduced stiffness. If you're enjoying this explanation and want more practical, natural health tips, subscribe and click the bell so you don't miss future videos. Now for the part that matters: how they work together. Think of olive oil as the lubricant and salt as the tiny brush. The oil lets your hands move smoothly and helps carry soothing compounds. The salt creates just enough friction and mineral contact to encourage circulation and fluid exchange. Combined, they can relieve tension, warm the tissue, and support the small repair processes our bodies do on their own. It's like oiling and lightly sanding a stuck hinge so it moves freely again. Here's the exact topical recipe and how to apply it safely. Mix 2 tablespoons of extra virgin olive oil with 1 teaspoon of fine sea salt or Himalayan salt. Stir until you have a slightly gritty paste. Warm a little in your palms first, so it's pleasant on the skin. Gently massage the paste into the sore area, neck, shoulders, lower back, knees, using circular motions for about 10 to 15 minutes. Focus on comfort and steady pressure rather than force. The goal is to coax circulation and loosen tissue, not to irritate it. After massaging, wipe off any residue with a warm cloth or rinse lightly with water. Use this routine once daily for several weeks, and observe how your body responds. When you first try it, expect a warming or loosening sensation. Some people notice reduced tightness after a single session, while others need consistent use for weeks before feeling significant change. Because everyone's body is different, keep track of what feels better: increased mobility, less morning stiffness, or calmer background ache. If you're already using prescribed topical medications or patches, check with a clinician before adding this mix so there's no interaction with your current treatment plan. A brief note on internal use. In some traditions, people take about 1 teaspoon of olive oil with a pinch of salt on an empty stomach, claiming it supports digestion and low-grade systemic inflammation. Treat this as anecdotal. If you're considering it, speak with your doctor first, especially if you have high blood pressure, kidney disease, heart disease, or are on a sodium-restricted diet. These populations must be cautious with any added salt, even a small pinch. Also, if you have allergies or reactions to olive oil, avoid internal or topical use. Safety reminders you should follow every time. Do a patch test on a small area of skin and wait 24 hours to check for irritation. Do not apply the paste to broken, inflamed, or infected skin. Stop immediately if you notice redness, itching, burning, or any unusual reaction. Don't increase the salt or oil beyond the small amounts suggested here. More is not necessarily better and can irritate sensitive skin. If you have persistent, sharp, or worsening pain, or signs of infection like pus, fever, or spreading redness, seek medical attention promptly. Putting this into the context of daily life, think of the olive oil and salt routine as a simple, low-cost self-care habit. One small action you can take in addition to good sleep, gentle movement, hydration, and appropriate medical care. It won't replace physical therapy, prescription treatments, or surgical interventions when those are necessary, but it can be a helpful complement for many people dealing with mild to moderate stiffness and chronic background pain. To recap, use extra virgin olive oil mixed with fine sea salt or Himalayan salt in the ratio of 2 tablespoons of oil to 1 teaspoon of salt. Warm it in your hands, massage gently for 10-15 minutes once a day, patch test first, avoid broken skin, and give it several weeks to see if your stiffness and discomfort improve. Some people also try a tiny internal dose, around 1 teaspoon of oil with a pinch of salt, only after medical clearance. Try this responsibly for a few weeks and see how your body responds. Important. Notice: this content is for educational and informational purposes only and is not intended to replace medical advice. Always consult a qualified healthcare professional or physician before making changes to your diet, supplements, or health routine. If this video was helpful to you, make sure to subscribe to the channel, like the video, and share it with friends or family who could benefit. Thanks for watching, and I'll see you in the next video.